This is Average Joe PT, and today we're going to talk about the foot some more. Last episode I talked about plantar fasciitis or plantar fasciitis. All right. Hopefully you guys will subscribe down below, ring the call bell. Hopefully get my subscriber list up a little bit. I'm going to keep bringing you content, but for the next couple episodes we're going to be talking about the foot for a little bit. And today we're going to be talking about tarsal tunnel syndrome, what things you can do at home to help your tarsal tunnel, as well as some things that the physical therapist might do to help your tarsal tunnel issues. So let's go ahead and get started about. All right, so what is tarsal tunnel? Right here, this little nerve represented by this blue band comes all the way from the top of your foot, comes on the inside, comes underneath from the inside of your foot, underneath your bone. All right, comes all the way underneath the foot. And you can see how if this gets irritated, it can be easily get irritated by if you have a flat foot or what I call pancake feet. All right, that kind of starts to push down. If you have some tendonitis along the posterior tib, which is what we're going to talk about next episode, some posterior tib tendonitis, and you can get some tarsal tunnel, involved with that posterior tib. All right, so this is kind of representation. Where is that nerve running to underneath the foot? And that can give you some tingling, some burning sensation, some weird type of nerve issues going on if this gets inflamed or gets pinched. So I'm going to show you a few techniques that you can do to help reduce your tarsal tunnel pain. All right, now the two treatments, one of them I did with plantar fasciitis last time, the meat chuck, or take the ice bottle, hopefully you still have it, that you're rolling with your foot, and tape. Tape's your best friend. All right, so we're going to use the tape, and we're going to use the frozen meat or ice bottle. Let's go ahead and get to it. All right, so when we're going to tape your foot, essentially, now the physical therapist might do this, or you can go ahead and get some tape from the internet, Amazon, Dick's Sporting Good, any of those. Obviously, they're not paying me for any of this, so I'm not endorsing none of that, but I know this is where you can find this tape, but the cheapest is probably going to be on the internet. Like I said, it's Luco tape or Meccano tape, whatever you want to do, but essentially, put this tape right underneath the arch of your foot, and you give it a big pull. All right. So you're going to pull that right up into, it's going to put it at the bottom of the foot here. It's wrapped around the rubber tubing with representation of the nerve. But essentially you're going to take that tape and just kind of lift the whole arch of your foot, and you're going to take it right on up to your shin. All right, so essentially what that's going to do is unload or lift up. It's going to lift up the arch of your foot versus if I let the tape down, your foot can kind of drop down. So that's one thing with this pancake feet. You can go ahead and lift up, and that will go ahead and support that tarsal tunnel and also support any of the other tendons as well as the arch, and that will help reduce some of that nerve pain. And like always, you're going to wear it for a day or two. I mean, if it gets itchy or rash, you take it off immediately, but it shouldn't because the foot's pretty rough. All right. The second one you're going to do is you're just going to roll this right on the bottom of the foot. I'll show you in a second. All right, so this technique you're going to do is you're just going to roll your foot on that nice ice bottle, or in this case, the chalk, for a good 1 to 2 minutes. Let that foot get nice and numb in that spot where it's burning right along that nerve. As that nerve's kind of coming up through there and comes all the way down and around and makes up the bottom of your foot. If you can get some nice ice in that area for a good minute or so and do this several times a day, that'll also help reduce some of that nerve pain and irritation that you're having. So that's a nice second technique. So those are two exercises and treatments that you can do at home to help reduce your tarsal tunnel pain. Now, in the physical therapy realm, what they'll do there is they will do probably some ultrasound to maybe reduce some pain. All right. They might also do some what's called iontophoresis. With a medication, what they use is they put some medication on the pad, usually some sort of steroid, and then they apply that pad around the area, and they use electrical current to push that medication into the skin. That might be another treatment that they do. They might do some deep tissue massage around the area, and they also might do some of that taping technique. Depending on how bad your feet are, they also might recommend orthotics for your feet so that you reduce the stress on that actual nerve. So that being the end of this episode of how to treat tarsal tunnel in your own home. All right, as I say, always look up, and keep smiling.